and today. They're the first of a series of programs that we have launched to commemorate the 30th year celebrations of FMES and IGME, and we're covering various themes in health and bioethics. My name is Sandhya Srinivasan, and I'm consulting editor of IGME. So in very brief, FMES was started by a group of health professionals who were concerned with the ethics of policy, research, communication, and public health. It is a publisher of IGME, the Indian Journal of Medical Ethics, which turns 30 next year and is today, 30 years down the line, a leading journal on healthcare and the humanities in this part of the world. Other activities of IGME and FMES, it's been since 2005, we've been organizing national bioethics conferences, bringing together academics, advocacy, and policy making in bioethics. And most recently, the Heal Institute, whose activities include bringing together people, experts in consultations to inform advocacy in health and healthcare. That's a bit about FMES, IGME, and NBCs. And I'll now turn it over to Usha Raman, my host, professor at the University of Hyderabad, to introduce the School of Communication and the topic of today's consultation. Usha?
Yeah, thank you. Thank you, Sandhya. And let me just, so I'm really delighted to be part of this collaboration with FMES. And I'm with the Department of Communication at the University of Hyderabad. And this collaboration really has been very meaningful because as a department engaged with media and communication theory, and also critique and practice, it's really important for us to build bridges with different sets of societal stakeholders. And health communication and journalism is a field that requires conversations across multiple boundaries if our teaching and practice is to remain relevant and grounded. So as Sandhya noted, this is the second of 2 roundtables in this series, which grew out of the realization that we've been through what can be thought of as an extended teaching moment. In our first roundtable, which happened on the 10th of October, we were joined by 2 journalists and a public health epidemiologist and a mathematician, who both talked about the effort to make sense of the pandemic in a way that was based on data, as well as the many challenges associated with that effort. Today, we move to a different set of related questions, and we have with us 4 panelists who represent diverse positions in the information generation and communication continuum. The questions that we would like to ask this panel to think through have to do with how one manages the interface between science and public policy, between governance and community, and how these acts of management and negotiation can work within an ethical framework that takes into account the lives of those that are at the margins. We've come to the realization that we're headed into an increasingly precarious future, and we're likely to face other public health crises that come out of climate change, resource scarcity, mass migration, and an ecosystem imbalance. How and what should we communicate in such a scenario? What information should be shared and how should it be shared? How can we evolve modes of communication that are empathetic, empowering, and educated, that allow people to cope in an emergency without resorting to coercion and fear-mongering? Before I turn it back to Sandhya to introduce the panelists and open the discussion, I'd like to just go over a few housekeeping points. We request all participants other than the panelists to keep their mics and videos off until the Q&A. During the panelists' interventions, please do leave comments and questions in the chat and we'll take them up at the appropriate time. And of course, there will be time for an open session of questions where you can raise your hands and ask on camera. So back to you, Sandhya. Is Sandhya here?
The problem. I don't know.
There you are.
Yeah. Okay. So we have with us 4 individuals who represent a diverse set of views and locations in medicine, public health, and health communications. So Pavitra Mohan is co-founder and director of Basic Health Services, which is an organization which provides health services to migrant workers. Gagandeep Tang is a virologist with the Christian Medical College in Vellore, and she has been speaking to the media on the COVID-19 pandemic and the public health and scientific response. Gina Nainan, I hope I got that right, Sharma is a health communications professional at the Public Health Foundation of India. And Seema Kumar is the communications and development expert at UNICEF India. I invite each of the panelists to make short introductory remarks of 5 to 8 minutes, addressing some of the questions that have been highlighted by Usha from their specific point of view, their vantage point, following which we'll have a moderated discussion and also take questions from the audience. We'll go in the following order. First, we start with Pavitra, then Gagandeep, Gina, and Seema. So, starting with Pavitra, I guess we can phrase the question this way, which is what vulnerabilities have emerged that you have seen that required sensitive handling in terms of information dissemination in your experience? Go ahead, Pavitra.
Yeah. So, while I think we were in the middle of the pandemic, everything seemed so imminent and so clear right in front of our eyes. And as the time goes by, it took me some effort to try thinking back about those horrible times. The pictures of, all of us saw those pictures of migrants walking back hundreds of kilometers. And that, got me thinking that we were at this end at that point of time. We were at the receiving end of where migrants were coming back to. And we realized that, how unnecessary it was to raise the panic at that point of time, which led to sudden, exodus of migrants from the cities where they were asked to hold back. At this end, we were in an area, we have been working in an area where there is a large number of people who migrate from South Rajasthan to cities like Ahmedabad, Surat, and Mumbai, and people were walking back, facing lathis and discrimination, not only by the police in the system, but also by their own communities. Because the fear that had been spread was that these are the migrants who are carrying the viruses back, right? And we actually, in a population of about 25,000, we tested and followed up about 1,200 migrants who were returning and found that there were one or two cases of COVID infection among them. So while and we've tried to find out why this was so, right? I mean, the COVID was already spreading in the cities, and they were living in the cities and coming back. And we realized that the life of the migrants in the cities is one of very isolated existence. There is very little interaction with the city people. They work in the factories or construction sites where there's very little interaction with the people in the cities who were actually infected, and that led to a sorry. So when they and this led to a panic, which was to our mind, quite unnecessary. But it also led to their own isolation from the communities that they were returning to. And this scare and the way they were treated at that point of time led to a lot of what happened subsequently in the second wave and what we called as vaccine hesitancy, because there was such a lack of trust in the system, the way they were treated in the first phase, and that lack of trust in the system and in in the information they were receiving from different places was really what affected the subsequent care seeking when the second wave, which really affected the rural populations, happened, and the subsequent vaccine hesitancy, as we called it later. So I think so there are 2-3 lessons to my mind here. One is that in absence, anything that has a significant impact on lives of people needs to be thought through a bit more carefully. And we need to collect evidence rapidly, clearly, and sharply before taking a decision that would affect millions of people, right? I mean, I think it would not have been very difficult at that point of time to understand the prevalence of what was happening to the migrant population and to support them wherever they were, and then gradually ease them, back to their without raising the scare that was there. So I think one was a lack of evidence. Second was lack of responsiveness and understanding of how people live in cities. And we say that 70% of India lives in rural areas, which is true, but a large number of them actually do not live in either rural or urban areas. They're always on the move, and quite a large number of them were in cities when the lockdown was first. So I think a lack of understanding of how people live and work, and having a centralized kind of decision making and a centralized information can be can really affect lives of millions of people, not only at that point of time, because what we realized subsequently is also in later phases promotes the mistrust with the systems that makes any information discredited, for a very long period of time. Yeah, so I would stop here for the timing and then would come back for.
Sandhya, should we
I'm
go
sorry.
on?
There's a problem with my internet. Gagan, here?
Yes,
Yes,
Gagan.
she's already
Hi,
in.
Sandhya, I'm here.
Yeah, so Gagandeep, yeah. So you've been a very important voice in the scientific community. What do you think we got right? And what do you think we got wrong in terms of communicating the science of the pandemic? Particularly when it came to vaccines. I mean, that's a lot.
Well, let's start with, I didn't think it was my job to be a voice.
Okay.
And, my job is to generate the evidence. It is for really policymakers to use the evidence that people like me generate and apply that to make the right kinds of decisions. So actually, it winds up being really frustrating when what seems absolutely clear and obvious to you is viewed with a great deal of suspicion and resentment in many ways, because all you're trying to do is lay out the facts as you see them. So whether that is in terms of the interventions that were put in place early on and carried beyond any sensible level, or it is about the emerging science of how the virus is transmitted, what kinds of treatments are required, what prevention strategies should look like. As scientists, it's our job to be able to basically say, this is how you interpret what we are seeing today. And if I was to think about what we got right, in terms of handling the pandemic, I'd say for communication, actually, very little early on. There was a lot of emphasis on preventive measures as best we understood them. So the idea of hand hygiene, the idea of social distancing, finally, the idea of wearing masks, which came 2 months into the cases increasing. All of those were really good things. And I was glad that those were emphasized. But then when evidence emerged that some things did not make sense, for example, lockdowns don't make sense if you have asymptomatic spread of a virus, then we continued to have those interventions being kept in place. And kept in place not as a public health issue, but as a law and order issue. And that's taking public health beyond any level of appropriateness, I think, especially for a virus that is not as bad as it might have been. If it was, if I was to rank viruses on a scale of 1 to 10, this one is probably a 5. And there is opportunity for things to be much worse than they got during this last pandemic. So I think that understanding wasn't really there. What we got right was ultimately we got things right in terms of communication. I think I spent about a month talking to my microbiology colleagues to say, what sense does it make to use an antibody test to define a cluster? I think there were so many missteps of inappropriate application of science that you could probably write a book on them. The corrections came late. By the time the corrections came, people did not necessarily trust the voices that were making the kinds of corrected communications. And I think that really is because people weren't listening to science, they were listening to people who were in positions of eminence. I'll stop there. Sandhya, you're on mute.
Sorry about that. Thanks, Gagandeep. Gina and Shita are both in the area of communications and communications management. So perhaps they could talk about what lessons you can gather from this, develop some kind of communication playbook for future health emergencies or health situations. So Gina would like to talk about that.
Sure. Thank you for having me on this panel today, especially with panelists whom I truly admire and have been following very closely. I'll just do a very short presentation to very quickly share some suggestions moving forward. I hope my slides are visible.
Yes, we can see them.
It's not moving. One second.
We just had your slide, yeah.
Sorry, I think it's like
They were up a moment ago.
yeah, sorry. A lag. So through this pandemic, we have learned that there is a need for a very effective health workforce and a multidisciplinary health workforce with different levels of the health system, with the understanding of the local context is very important. What we have seen is the public health student actually gets a little bit of exposure of various subjects. So there are people who are introduced to epidemiology, biostats, sociology, anthropology, communication scientists. And through this pandemic, we have seen how students have helped extensively in contract tracing. They've worked with the National Center for Disease Control. In this, they've helped identify vulnerable people, building capacity in prevention of in the preventive messages. We've had teams at the Indian Institute of Public Health, Hyderabad and Gandhinagar who have worked as field epidemiologists, students who have actually helped in fact checking and also counseling at the community level. The pandemic has also shown the need to build partnerships and evidence-based solutions. For example, we are all aware that we were, inundated with information, right or wrong, and then we didn't know how to deal with it from a common man's perspective. What we have tried to do, and as part of this whole exercise, is actually trying to get public health professionals being trained as infodemic managers or as fact checkers. The COVID pandemic has shown that social media can play a very integral role in providing information. But what has happened is also there's a lot of misinformation and even more disinformation. So partnerships with Twitter, Facebook, and now YouTube, which actually runs now a Trusted Flaggers program, will enable more credible content available to the target audiences. So I think moving forward, building a network of public health professionals who are trained in infodemics and misinformation so that we can leave the experts to do what they're best for. The pandemic also actually showed that messages which were coming nationally or internationally need to be contextualized to the local context. So we've seen that, for example, we have 6 Indian institutes of public health. They've all dealt with the pandemic in different ways, and we've seen that strong networks between government, institution, society, technology partners, and community is very helpful, and thereby emphasizing the need of multidisciplinary talent building. I'm also just going to very quickly touch upon the importance of regional partnerships. Sometimes information given in a particular language does not get translated into the local languages. And some channels like ETV were very helpful in disseminating this to a much wider audience in more than 12 languages. We see that there are needs to actually connect with special groups, people with disability or people with different conditions. There are platforms like Patient Engage, which we have used to create much more discourse and enable specific information, distilling it to the target audience it is intended for. Sometimes we only look at information just beyond the mass media, but sometimes we also see that information is required for niche audiences like policemen. There were children. We created guides for bio waste management for COVID and also for hospitals. So just to summarize, credible ecosystems for scientific discourse and communication, efficient networks, social platforms are going to play a major role moving forward. Technology platforms, how can we use that data and information and help reach wider and the unreached? Thank you very much.
And there you're muted.
So sorry. Okay. Seema, thanks, Gina, first of all. And Seema, could you kind of talk about how the state managed or mismanaged communications and how it has impacted communities? What could have been done differently?
Thank you. Thank you so much. And first of all, Usha, so grateful to you for having me here and all other organizers. As UNICEF, we have been engaged in risk communication and community engagement, especially for this particular pandemic since, I think, March 2020. So there have been so much of, I think, information overload in my own mind when it comes to communicating about COVID and related issues and also engaging with communities. And then I think for the past 6-7 months, we have been able to focus on, pay attention to other issues and more so COVID sensitive issues, which really other issues like nutrition and health and learning and so many more, which were impacted due to COVID, and we see a reverse in the indicators for some of those issues. So coming to specifically to your question in terms of how did we manage the communication or the miscommunication sometimes, I think we also need to recognize the fact that the situation was evolving and changing, I think, every hour. And I think the previous speaker also spoke about the lack of scientific data, and that was one of the major challenges for us as the communications team, working very closely with the government and other partners to unpack that scientific information and meaningful information for general public, for communities. So that was like, I will just give an example of, we were talking about social distancing, but then distancing by how many feet was also changing very rapidly. We were talking about usage of masks, but what type of mask? What type of mask for which type of situation? So if you're in a health institution, what kind of mask is required? If it is a healthcare provider, or if it is somebody attending to a COVID patient, or working in a health facility. So there was like so much which was very rapidly changing and evolving, and that was a major concern for us. Second is we realized pretty early on, I think around April 2020, that government would not be able to do it alone. Government does need to collaborate with other partners, other actors, and everybody has to be in this. And that's where we started advocating with at the national level and also at the subnational level, the state governments, in terms of involving others. And then within government, we also realized that it is not only health departments, response. It has to be a multi-sectoral response. So that's where in across all the 3 states, and that was a positive that I would like to share, that all the state governments were quite receptive, and they were very quickly interdepartmental coordination groups constituted, which are at least on WhatsApp exist even today, and which have all the HODs from all the relevant departments. Because there was also this trend that we saw of urban to, and I think Pavitra was talking about it, urban to rural transmission, but there was also this unnecessary panic which was created pretty early, and we were not prepared for it. So we also requested the government and other colleagues at UNICEF and partners from WHO and others that we need to prepare instead of creating panic. We need to prepare in advance, because once these people start going back home, our response currently is very much urban focused. What is happening in urban areas, and within urban areas also the contact tracing and isolation, and going to these societies where people were returning from overseas travel and marking those houses. So it was quite a few months initially, it was very much urban focused, and that too urban focus, not so much among urban slums. And that was another challenge for us. What do we had as UNICEF? We did not have enough experience of working with people living in the urban slums. So that was another learning experience for us. But I will just go back to the point of the importance of having multiple departments, come together for that. So working with the RDPR, and I think our friend from PHFI was mentioning about the capacity building initiatives which were undertaken for Panchayati Raj institutions, and that's where UNICEF collaborated with PHFI, and we rolled out like massive trainings. And this was again the virtual world we all were operating in. So even PRI workers. And then we realized that everybody may not have the best of data connection and may not have access to Zoom and Teams and these kind of platforms. So then I think we were also trying to be more creative and adaptable in terms of how we were engaging with people. So there were different types of videos that were being developed so that those could be uploaded on YouTube, and that becomes a resource for PRI members. And what would be the messages for them? That please do not stigmatize. Please create, if required, create isolation spaces, because rural households and also urban households were like the home is 10 by 10 ka room. So that is not, where would you isolate a family member? So these were the kind of messages that isolation and provision of testing kits and things like that were part of the trainings. And I'm very grateful to PHFI that we did some work together with the government in AP and Telangana both, where like large scale trainings happened. That said, yes, that is not adequate, because we also understand the limitation of trainings in virtual spaces, and especially for that level of stakeholders. Coming to community engagement, I think our challenge when it was about working in the urban slums, and we had no understanding about how information flows, because in rural areas you have quite a few standard platforms one can count upon, whether it is especially in the southern states, the platforms of self-help groups, which are like massive and very well connected. You have PRI's structures also pretty much well laid out. We have other structures like the NSS, youth networks, which are quite strong here. But how do we operate in urban areas? And that's when we got together with our CSO partners, and to understand what happens, how do we communicate, because people can't go and meet people, interpersonal communication cannot happen, meetings cannot happen. So what would be the best way, and who would be people from their communities they will trust upon? And that's when actually we developed a strategy for urban, and then we also discussed that strategy actually for Maharashtra, Mumbai also. And we recognized a few interesting things which we did not know about the urban areas, especially that even in urban communities, urban slums communities, there were WhatsApp groups of the societies that were existing. They were some leaders from those communities. They were small factories, small shops, and they had those unions. We had no idea about some of these structures, which was quite organic and not very organized. But I think there is scope to tap into those. And I will just stop before we get into more discussions with one learning that I think we were not prepared in terms of risk communication and community engagement for such a pandemic. And thanks to the pandemic, there has been a lot of advocacy and acceptance among the government to invest in this, invest in system strengthening. And I see a lot of opportunity to collaborate with some of you to take that forward. I'll pause here. Thank you.
Thank you, Seema. Again, I'm looking for Sandhya, but maybe she's dropped off because of the network. But thanks all of you for your interventions. I think, it seems like you've come at it from different directions, but I think there's a lot that one can actually build on. And if I were to just very briefly summarize, it seemed like, on the one hand, we started with Pavitra, who talked about the lack of imagination or understanding of how, how some of these vulnerable groups would be affected by the decisions that were taken in a very centralized fashion. And in some ways, when Seema ended, she came back to that point of, not understanding how certain vulnerable groups actually live their lives, and how do we then communicate with them in effective ways that taps into the networks of trust and so on that already exist. And I think what Gina talked about was a solution to that, which actually lies in intersectoral cooperation and coming at a problem through looking at it through different lenses. But I think I'd like to also start with what Gagandeep said, which is that in many ways, you started off, Gagandeep, by saying that your job was not to be a voice. And I'm just wondering, through the pandemic, through the first wave and, subsequently, nobody knew whom to trust, right? And which set of voices should one listen to? And I'm wondering how does the public deal with that? Who do we look at? We tend to look at the government, but then when the government is not providing answers, then we look to different groups. And in this case, you became one of those people that people listen to for the science. So you did say that it was frustrating sometimes to be not listened to by the decision makers. But how did you negotiate that role? Would you like to speak to that?
Yeah. So if I think about my training at CMC, I think that makes up a large part of how I approach science, as well as communication and what the science is meant for. Because if science doesn't lead to equity, it's really not doing its job. So I think from CMC, one of the things that we've been taught is that when you have to make decisions, you have to have data to back them up. And if there is no data, you have to recognize that you are making an uninformed decision, which may be necessary in an emergent situation. But when that situation changes, then your decision should be informed by the facts as they are at that point in time. And I guess that's the principle that I stuck to. If I knew something, I said I knew something. If I didn't know something, I said I don't know something, or this situation is evolving and we will learn with time. And I think what we don't recognize about communities and the people that we are communicating with is that everybody has the ability to understand and to deal with uncertainty. We do that in many other aspects of our lives. Why should we be incapable of doing it when it comes to communicating information that is relevant to public health? So I think in the work that I've done working with communities, the one thing I've learned is you have to be honest, you have to be transparent, you have to tell people the limits of what you know and don't know. And people do respond to that. So that's pretty much what I did.
Yeah, I mean, that's a really important point, because I think even on Monday when we were talking about, how journalists, for instance, dealt with uncertainty, and the fact that the traditional journalistic storyline is to have neat resolutions. And in this case, all through the pandemic, there were very few points at which you could say there is a neat resolution. And I think this also relates to what Pavitra was talking about in terms of loss of trust. So there is one paradigm within which certainty is what leads to trust. And there is another paradigm in which you say transparency, even if that includes communication of uncertainty, is what leads to trust. And I think what ended up happening was a reliance on the former model rather than the latter. But would one of the others like to comment on this whole loss of trust because of the refusal to communicate uncertainty? Pavitra, would you like to speak to that?
So, I think one of the problems with our health systems and systems in general is highly centralized way of thinking and functioning. And I think the more it is decentralized, people know that you can't, enforce messages or enforce decisions on people, and that the person at the front end knows very well, right? Because you are there, you have to build relationships. The care at the front end is all about relationships and trust, and therefore a frontline healthcare provider or people there really know the importance of what it does and doesn't do. But when the decisions are taken centrally and the frontline healthcare providers in the primary healthcare level are only supposed to transmit that and comply with that, that leads to a situation where whatever trust exists also kind of dissipate. So I think the focus on decentralized provision of services as well as decentralized decision making is so important to engage communities. You can't engage communities with orders from Delhi or from wherever else. You can communicate science from more centrally because everybody can't generate their own science. But how do you use that to either provide care or to disseminate information or to engage with the communities? It has to lie with you have to give that leeway in the front. For example, in the towards the second wave, people were forced to say that either you accept vaccination or you would not be provided ration, right? I mean, that led to a distress where even a sane message, something as simple as Gandhi was saying that, if you communicate, we actually went out and shared I remembered, discussing with families, actually we were showing them what an epidemiological triangle means and why therefore it is uncertain that it's not only the virus. So you're actually going around with charts of epidemiological triangle, talking to people about it. Whether that is possible, it is not possible in the given to engage with communities at that level because we have not invested or we have not, and I think one of the problems overall was also lack of engagement with the communities or organizations working the communities, and that then the only alternative is to pass on orders and rules which people at the front have to leave. So I fully agree that transparency is important, but transparency doesn't come in non-transparent systems and in centralized systems. It only comes in more decentralized systems. So.
Yeah, I'm wondering if Seema wants to take up on that, because in some ways, this is what you ended up having to do, right? I mean, create new networks in the community that allowed you to build trust or to rebuild trust in this scenario. So
yes,
I know that you did talk about that, so maybe you could elaborate.
Yes, so some initial, after some initial struggle, the advocacy that we had and with the government to really involve also the civil society organizations. So in all the three states where, we from this office operate, Andhra Pradesh, Karnataka and Telangana. So I will quote examples from there, although there are similar experiences from other states also. But that happened a little later, not in the beginning of the pandemic. But what we did in AP, and that was in complete collaboration with government, was that we mapped out about 1,000 NGOs, and those were linked with the joint collectors at the mandal level. So that collaboration in AP really helped because they were also, like many other states, they were at some point were conducting fever surveys. I don't know, scientifically and medically, I don't know how good or bad that strategy was, but some of these responses were happening, and there was a very good hand-holding between the service provider from the government side and CSO mobilizing the communities, building their trust. So that helped. Communities opened up a little more when there was the involvement of the local CSOs. So that was like listed, documented, and their numbers were exchanged. And there was, at the district level, there was one, if I may call it, a mother NGO kind of an organization. And then that NGO was collaborating with the Joint Collector's Office, who was responsible for COVID response. And then they were taking help from various NGOs. So about 1,000 NGOs were functional in AP. And similarly, even in Telangana also, and I think some of them are present here. I saw somebody posting a comment. So even in Telangana also, and particularly in some of the urban pockets where it was more challenging in terms of our response and community engagement, we built that network. In Karnataka, they actually delegated the community engagement responsibility to the Panchayati Raj department, and that department worked with UNICEF, and we mobilized civil society organizations. And they, in fact, also worked out a dashboard. So there was a lot of dynamic reporting, and that was happening. So that was one intervention that helped. But yes, initially there was that hesitation to involve and open doors to others to come and help each other.
So I'd just like to go to Gina for a moment and ask about, many of the examples that you shared with us, in opposite and not in contrast to what Seema is talking about, which involves much more on the ground, talking to communities face to face, or in small groups. In contrast to that, we have the kinds of initiatives you're talking about, which is more mediated, right? I mean, approaches to fact checking or creating social networks, mediated social networks, and so on. And I'm wondering, how does that, if you're keeping vulnerability in mind, how do those initiatives, form a layer of protection against misinformation to vulnerable communities?
So, to be honest, actually, we did something a little reverse. Sometimes what happens is a lot of scientists and also public health professionals were also, agents of misinformation, because sometimes you tend to pass on what you get on a platform like WhatsApp. So the idea was to also encourage them to think before they disseminate any information, because what happens is the initial urge is to, since there's so much, everything changes so rapidly, people were sharing information immediately. So what was done was public health professionals undergo the training. There's faculty, researchers, as well as students who are interacting with the community. So ensuring that the messages are very simple, easy for the community to understand, and more importantly, in the local language. So even the material which goes to them would only entail a picture and maybe just one line, one or two lines, to ensure that the uptake was higher rather than causing more confusion.
Yeah, so I'm wondering if there are questions from the floor, because I did notice that Leslie Martin had a couple of comments, and one of his questions relates to vulnerabilities, and how do you communicate these kinds of issues to people who are vulnerable. So would you like to elaborate on that question? Leslie, would you like to unmute and ask?
Yeah, I was involved in the survey of UNICEF in Hyderabad bus fees. So I was looking at the vulnerabilities. Differently abled is vulnerability. Location is one vulnerability. Caste is vulnerability. Gender is one vulnerability. Age is one vulnerability. And access to resources is another vulnerability. And information is another vulnerability. So how, as per Disaster Management Act, how the early warning should have reached, how it should have been communicated to the appropriate person, so that that person can manage the misinformation that is coming. That vulnerable person can manage, because he is the first person, he or she is the first person who is facing the pandemic. in their ground reality. That was the elaborating.
In many ways, perhaps Pavitra could speak to this. In many ways, actually, what they were facing was not so much the pandemic itself, but the decisions that were made as a response to the pandemic. So how would you like to respond to Leslie's comment?
No, I think I would only say that I agree with what Leslie is saying, that ultimately, I think it's, look, the vulnerability cannot be mapped, and that map is not useful. Ultimately, there are people behind it. And if the systems are responsive, they would know where the vulnerable people live and who the vulnerable is. It doesn't need, but only if it is, as I said earlier, even at the cost of repetition, that if they're decentralized and responsive systems, they would identify who the vulnerable. They don't need to really, have a definition of who the vulnerable are, and they would reach the people as per their needs. But that does require a stronger and responsive systems, which are closer to people, closer to where they live, and understand where they live and how they live, and what their needs are. So I think a greater engagement with the communities, with the systems, mediated or unmediated, is really important. I mean, if you're a neighborhood clinic, you know who have what needs, right? It's fairly simple. I mean, I've in my past, I've worked in several disasters, and I think the most important factor in immediately response to any disaster is the community itself, right? People around you, because anything else comes much longer to come in, or would never know. So I think building those resilience in more peripheral and closer to people's systems and in communities themselves is how one would be able to reach out to vulnerable populations and to those in needs and respond appropriately.
And I think this also relates to another comment in the chat, which from Vinod Pavrala, who talks about community radio playing a major role, because that is media that is close to communities. And in some ways, I was struck by something that Gagandeep said, which was that this virus ended up not being as dangerous as we thought, on the scale of viruses. So do you think then that the response was, the initial responses were, way out of proportion to what in some ways you hinted that, but I'm just wondering, considering the stories that were coming from overseas, from Italy and, other places, there was this sense that this was a huge crisis.
Yeah, I don't think that the initial responses were overboard, because when you don't know, you want to have as much protection as possible. But you can begin to dial that back as more data emerges. And that's why making sure that you have the right kind of data to inform future decisions is absolutely essential. We were borrowing from China and from Italy in terms of the lockdowns. And we had one of the most stringent lockdowns in the world. But then when you look at, as soon as it was lifted, your cases started climbing. At what stage did we have sufficient data to be able to say, this is a strategy that's not really going to work to prevent infections forever?
Yeah, so the willingness to admit uncertainty, the willingness to say that now we have new information, so let's think differently, that kind of approach was lacking, I guess. There's a hand raised from Chetna. Would you like to unmute and ask your question?
Yes, I'm Chetna Belgere here. I'm with the South First, newly launched website. My question is, now we've known that, it's not that there was no tracking happening of these viruses, or there was no, it was all happening, right? And we've seen how the whole, the pandemic has unfolded. Now, looking at the way forward, now there is a lot of re-emergence of viruses which are which is also happening. So we are kind of stuck with this COVID thing now. When we look at, we know that these are the mistakes which we have done, but looking, I mean, what is the way forward? Is there any anything which either Gagandeep or any of you can, there may not be a one set of sort of answer for this, but then is there anything to immediately look into?
Can I just ask, do you mean in terms of a scientific response, a public health response, or a communication response?
Yeah, I think everything together, isn't it? I mean, that's what we have been discussing, that it has to be a plan together now. So when we're talking about this, there is no way, we have still not arrived at a platform where we have data put together. So we've still not done a lot of things. So is there anything which is to be proposed, or which is already in the minds of people, like where you can all come together and do something? Is there anything of that sort being thought about?
Yeah,
I think if we look at what's there on paper in India, on paper, we have everything in place. We have appropriate data systems. We have appropriate communication strategies. We have ways of delivering the right kinds of supplies to the right kinds of places. But it is the implementation that is very, very different. And certainly when it comes to communication, I think we forget that some of us have communication channels across the board. We can learn from the world. But there are others for whom these kinds of communication channels are not available. And therefore, it behooves all of us to make sure that the right information gets out there. And that we don't have in place at the moment. Our systems are geographically and socioeconomically not well distributed in terms of any kind of preparedness.
Thank you.
Would any of the others like to respond to that? I mean, in some ways, it seemed to me that what Seema was saying was that there has been some kind of coming together, certainly not in the way that you're suggesting, Gagandeep, but in a different kind of way.
Yes, so if I can come in, Usha, I think we sensed a little more openness to collaborate and to bring different actors into this game to respond better. But as Dr. Gagandeep was saying, I think it is very, very critical to do a review and work on the system strengthening and all the aspects that Chetna was seeking, including communications. Working with different actors and collaborating becomes very, very important, because this has really taught us how unprepared we were. And I will just share one small example. I think it was 2016 when in Hyderabad there was a strain. It was not a polio case, but there was a strain of poliovirus that was found in the sewage water in one of the slums, and that required an emergency response. And we had to, together with government and other partners and WHO, there was a need to vaccinate children of like up to the 15 years of age, actually, because we had otherwise already eradicated polio. That time it was not the OPV, it was the injectable, and about 3.5 lakhs children within 2 weeks' time. That level of response was required. It was not a mean task to do. And that all the partners responded to it together. And we documented that experience. We had shared those experiences across the states with all the NHMs and other relevant partners. Karnataka came forward and requested UNICEF and WHO to build their capacities in RCCE and a few other areas. And then we collaborated with Manipal University, and they did a risk analysis, including local disease outbreaks. So which are the areas where more of malaria happens and seasonal outbreaks. And then a system strengthening or a capacity building exercise, at least, if not a full-fledged system strengthening, was taken forward. Looking back, I think it helped Karnataka a little more, probably because the teams were a little more prepared. They had better understanding of how to engage with communities, and what Dr. Gagandeep was saying, that what we know, what we don't know, and what we are trying to know, and how we are trying to know. So maintaining that transparency that also probably helps. So if we invest, it will certainly give us better results, and we will be better prepared for such situations in the future.
So I just wanted to add something. I think one of the things that really struck me about this pandemic was the number of people who were willing to volunteer their time and expertise across the board. When it came to data, there were volunteers that were scouring newspapers and state reports and trying to put together data sets that weren't available anywhere else. When it came to helping out with communication, with delivery of interventions during the oxygen crisis, people really stepped up. And the communication channels that were set up, for example, in Madras during the floods, that same willingness to help your communities came right back again. We don't have a formal volunteering structure, and that's maybe something for us to think about. How do we get people to contribute their time? Because there is a lot of goodwill in the work. We just need to make sure that we harness it.
Just taking on from that, I think it's a great point you made about the need to create volunteer networks that can then be tapped into when there is a crisis. And in some ways, this also relates to the notion of how we see ourselves as a community, right? Or as a group of communities. And there's a comment from Veena Shatrugna in the chat about stigmatization. And she says that it's about time that experts took a stand. And I'm wondering if there is a response to that. I mean, there has been quite a lot of critique about how, Muslims were stigmatized during the Tablighi Jamaat event and so on. And I think Pavitra also mentioned the fact that migrant workers themselves were stigmatized in their communities. But do you think there's a response from the scientific establishment that could help mitigate these kinds of stigma? Any of you? Maybe Gagandeep can start and the others can take it.
I think in terms of mitigation of stigma, we can show quite clearly, just based on the serology data, that isolating certain communities actually made no difference to the course of the pandemic. So there was no cause for blame or for othering certain communities, because there really isn't a difference in who got infected and who didn't. It was making people into, I don't know what the right term is.
I think scapegoating was used a lot.
It's not even well, part of it is scapegoating, but it really was, I don't know, I'll have to think about what the right description of that would be, but considering people responsible for spreading disease through their inappropriate behavior was obviously not an accurate conceptualization. Now, what can the scientific community do beyond writing about it? Which I think they have done to a fair extent, but they haven't taken it out and said, you didn't need to stigmatize this or that community. Now, is that something that should be done in a scientific paper? Well, the community that you're speaking to in a scientific paper is one that already knows this. So it's really about communicating the same to the public at large. And that is probably done better through different media channels than it is through our usual scientific mode of communication.
Yeah, Pavitra, would you like to speak to that?
I think we before COVID we had a huge experience of stigmatizing people with HIV, right? I mean, we had decades of experience, and we knew that once you ameliorate that stigma and once you address that through a series of measures, how it really helps to prevent or manage an epidemic, right? I think that was one of the big lessons of managing HIV epidemic, was that the moment you stop stigmatizing, it is so much easier from a public health perspective to manage an epidemic when you start talking about it, when you don't blame the victim, I mean, talking of migrants before COVID, if you search for migrant and health, HIV would loom large, as if migrants are responsible for, they're victims of the circumstances in which HIV affects and transmits through them, right? I mean, so I think by blaming the victim, from a public health point of view, it does perpetuate the epidemic through which everybody else gets affected. I think so. So that's another message, that it's not inequities in healthcare, stigmatizing people would always backfire. It would never, it would engulf everyone else as well. And the moment there is greater equity, there is greater acceptance of everyone, there is greater concern for everyone, there is access to healthcare to everyone, it helps everyone. I mean, there's no country in the world where there are huge inequities in healthcare and still overall health status is good, right? I mean, America is a glaring example. Despite spending so much money, huge inequities also mean that there are overall people are at risk. HIV continues to flourish, and the COVID, we knew how it affected the health system there. Not because they did not have resources or evidence or anything else. It was because it is an inequitable system where any disease or an epidemic would flourish. And I think that we need to understand, which we did not, unfortunately, from the epidemic.
Although
we realized it for a very short period of time when rich were really, getting affected, and there was difficulty in accessing healthcare by everyone, including the rich, which a poor person faces every day. We work in an area where there is huge silicosis, and people continue to die of lack of access to oxygen, even currently, because, but it was only that during that period we did understand it at some level, but I think stigmatizing is part of exclusion, right? I mean, and that exclusion would never help in any ways.
Yeah, so I'm thinking, if we have to, it seems like we forget lessons very quickly. We forget realizations very quickly. So if we were to institutionalize in some way, or at least have a playbook that can be applied by those who wish to apply it in other emergencies, if you had to add a line to that playbook, what would each of you put into it? Of course, you might have already said it, but if you had to say, this is at least one thing that I would like to change about the way we communicate in public crises, particularly health crises, recognizing what we now know or have known for some time about inequity, about unequal access, about context, all of that. Anyone can go first.
Can I come in, Usha?
Yes.
Yes, so I think one thing, and that we realized, and all of us realized, I'm sure, is that we were counting a lot on social media and digital spaces for communication for very valid reasons during the lockdown phases and the peak of the pandemic. That said, I think we need to, and that was not enough. And we have been doing a few rounds of social listening. And what we are recognizing is that social media has become one of the least trusted sources of information as far as COVID is concerned. And we were asking questions to the agencies who were doing this work, that is it true for other issues also? Or can we count on, for promotion of nutritional behavior through social media, or that also will not be trusted? So I think we need to revisit the drawing board and see in case of such pandemics in the future, are we going to count on that, or do we need to build systems? And that would, of course, will help in community participation and community engagement also, the local systems for the information exchange. And we had some interesting experience from AP, because it's a unique state in the sense that they have identified volunteers across the state, and they are paid by the government, and each volunteer is responsible for 50 households in rural areas, and I think 100 in urban, or maybe vice versa. And they have complete data, complete information of the 50 households, and they are part of a WhatsApp group of those 50 households. So that system came in very handy to us for communication, and then they were able to mobilize other volunteers also. But I think building community resilience and involving communities in different ways, and not only counting on digital and social media kind of spaces is one big lesson for us. And that, of course, will happen when we invest in system strengthening and we recognize that there is a weakness there and we need to build on this.
There's many points in that one point. Yes, thank you. I know that Gagandeep has to leave soon, so can I call on you next?
So I think what Seema said is really important, but I'd like to extend that a little further and say communications are required in peacetime as well as during crises. You don't build trust during a crisis. You use the trust you built outside of the crisis to handle the crisis.
I mean, and again, you mobilize networks that you have created in peacetime to work during a crisis. I mean, absolutely great point. Yeah, Gina. Okay, I don't.
Sorry.
Yes.
Yeah.
Yes. Yeah.
So my wish list would be actually technology, like Seema said, technology partners are going to play a major role, and there's going to be this plethora of data available. So how to reach, whom to reach, and what we can do with that information. So that's going to be important. Second is multidisciplinary teams, building, like everyone said, an ecosystem at the state level, district level, and also inclusion of other expertise like social scientists into policy discussions, expert groups, which can look at the whole community perspective, because we need to expand that expert panel, and even mass media, when they actually invite experts for discussion, can also look at different angles beyond the epidemiology perspective.
Yeah, and before I ask you, Pavitra, to speak, I just wonder if in your comments you could also address this question in the chat, which is from Sunita, who says, during monkeypox, we seem to have forgotten the lessons learned during COVID, and why can't we build on these learnings? So if you could also talk about
that. So, for me, I think, in fact, what I wanted to say Gagandeep did speak about it, that what you do in between the crisis is really important. And for me, I think in between the crisis, building strong health systems which are responsive to needs of people is really critical. I think wherever there were stronger health systems there, we saw how it was not only the epidemic, but also continuity of services that was maintained. But one thing we haven't discussed much today is that a lot of damage that has happened last 3 years is, of course, on account of the pandemic, but also a lot on account of discontinuity of services, which happened in between. And wherever the systems were stronger and were closer to people, those continued to provide services, and therefore, were able to manage that uninterrupted services, and therefore the health status of those populations continued to remain much better than where the systems were more centralized and more unresponsive. So I think building those strong systems in between the crisis is really important. Engaging which are closer to communities and understand them better. So that was that was one lesson that we clearly felt, that how important it is to be present right where people are and understand them. The other, on the monkey, I agree. I think the problem is that again, that whom does it affect really, right? I mean, and I think that's the lesson. And probably no, I mean, as these scientists can probably are not the best people to talk about, and probably even not communication professionals. I think as a society we have to be someone which are which believe in equity and which believe in fraternity and brotherhood, and that's a longer ask, but all of us are, besides being professionals, are also individuals and citizens whose responsibility it is to promote that harmony and that sensitivity towards each other. That, to my mind, is going beyond one's own profession, but each profession also demands that as well. If that is what affects lives of people around us and our own, brothers and sisters around us.
Yeah, I mean, I think, in some ways, what you're saying, what all of you are saying is that, during a crisis, yes, we learn certain things, but those learnings really need to go back into strengthening the system that is pre-crisis. I mean, we shouldn't have to wait for a crisis to find strength within ourselves. That strength has to be built in peacetime, and it was interesting that you said between crises. So that's kind of a cautionary tale, right? That we're never going to be in a situation where we will not have crises. In fact, we're likely to have more and more of them. Do we have any other questions from the floor? I know that there was one question about governments, how open really are they? And I know that Seema had a very positive experience with, working with the governments in this region. But do either Gina or Pavitra, do you have anything to say to that?
I think, like the civil society, government is not a monolith, and there are, I think there are different kinds of government. There is a difference between different states. There's a difference between different districts. There's a difference between different people there. So I would not think that should not kind of deter us or make us think. I think the question is that, do we want to engage with governments, and does the government want to engage with civil society? Whether or not that happens, it is important to do that. I mean, there is no other way but to for governments to engage with the communities and civil society, and the civil society and the communities to engage with the government. They are part of the same kind of cloth, right? Ultimately, we need to. Point is that if we keep communities at the center, whatever is required, right? I mean, there are resources on either sides. There is strength on either sides, and to bring them together is really critical. So I would not think whether government is interested, not interested, this bureaucrat is good or that is bad. The question is that it's not a person. There is a responsibility. The government is for the people, and we need to keep reminding that if people forget that. And similarly, as citizens, we have to continue to do what we can, both individually and on holding the government accountable, as well as support wherever that's required. So.
Yeah. Gina, do you want to have the last word on that?
I would like to add that, it will be helpful moving forward if government actually has systems in terms of technology, dashboards available, where data is readily available for people. Because otherwise what happens is we are all scrambling for data, or we're looking at other organizations or international websites for that basic information. So I think the learning from this is, if they have at least the technology in place, India as a country is very well known for this. We have these systems in place, and also regionally ecosystems like we all talked about, where there is a diverse set of people already in place, so that they're communicating, they're reaching out, institutions, technology partners, government, civil society, communities. That's really the right way forward. That's how we hope it will take shape and form.
So really, we can't give up on anybody. We can't give up on government. We can't give up on civil society. We can't give up on each other. That's the bottom line. And I think we have some pointers and that we can use to, put together, that maybe we can share with other groups that are working, either in community work or in media, that, we can maybe solidify these lessons from COVID to go to the next crisis, so that we deal with it a little bit better. But I'd like to thank all of you for being here. I know it's a weekday evening, and all of us have had many webinars and online meetings that we've been a part of, and sometimes to the point of fatigue. But so I really appreciate your time. And thanks to those of you who attended and stayed till the end. And a big thank you to the FMES team who helped put this together. The plan is that we will summarize the discussions from Monday and today, and try and distill a set of recommendations that we will share with you before we publish. So thank you all. And I see that Sunita has a question, or FMES. If everyone can turn on their cameras to get a screenshot. May I request participants if you're okay with turning on your cameras? And Sunita, you'll have to tell us when we can stop smiling. Thank you.
Thank you.
So thanks everyone, and have a good rest of the evening. And hopefully this is a conversation that we can continue to take forward.
Thank you. Thank you so much, everyone.